Good evening, everyone. I'd like to thank you all for being here, and I'd like to thank the HIKMA team for inviting me to give this talk today. So today I'm going to talk to you about low back pain, which is probably a pain that most of you may have experienced at one point in your life. But I'd like to focus on aspects of the pain experience that tend to be neglected in medical understandings. So I'd like to look at the social and emotional factors and their significance in understanding pain and dealing with it. But before we get into that, I want to share with you some research findings. Now, generally speaking, when a person has low back pain, they're referred to a physician. And depending on the changes that show on an MRI examination, the physical changes, they are given a diagnosis or a standardized label to explain their pain. But what research over the past 15 years has been showing is when an MRI examination is carried out on samples ranging from 46 to 98 individuals with no history of low back pain, so no pain in their backs. And they had a really diverse sample, so young adults in their 20s to people in their later 60s. And what they found was 35 to 93% of those people show degeneration, which is a common diagnosis that people get. It is deterioration of the bones and the discs in the spine. And even though they didn't have back pain, they had those physical changes in their spines. They also found that 20 to 76% of people have a herniated disc or a slipped disc. And the reason I'm showing you this image is because a lot of people with back pain are shown similar images. And they're shown levels where the disc slightly shifts out of its position, and they're told, this is what's causing your pain. But actually, 76% of people that don't complain of any pain have similar changes in their spine. And finally, 1 to 21% of those people have some sort of nerve compression, but don't even know it's there. Some more interesting statistics. Only 15% of low back pain can be diagnosed. So only 15% of people's pain can be attributed to a physical cause, which means that 85% of people's pain cannot be given a diagnosis. And so this starts to show you the limitations of medical understandings. We can only explain 15% of low back pain using those understandings. And so from this brief discussion, we can conclude that although back pain is experienced physically, it's not necessarily caused by a physical problem or physical factors or changes in the spine. And this is what sparked my research. I wanted to understand why people that are given a standardized label or a diagnosis don't experience pain in the same way or don't behave the same way, because people's pain is very variable. And when people live with chronic pain for a very long time, it becomes a part of their daily experiences or a part of their identity. So a lot of social and emotional and cultural factors come into shaping the pain experience and people's behaviors towards it. So I'm now going to talk about my research study. My study was a qualitative study, which means I focused on women's subjective experiences. I used interviews to collect data, and the interviews flowed depending on the factors that women felt were important rather than my own professional understandings or research agenda. And I followed some of those women over a course of a year because I wanted to see any changes in their pain experiences, and I wanted to explore why people's experiences change over time. Now, although my research study focused on women, a lot of the ideas here may resonate with males' experiences as well. What I found was that women's experiences with pain and their behaviors towards it can be explained through their illness identities. But before I talk about those illness identities, I'd like to talk about the cultural context in which those identities developed. So the women in my study talked about conservative norms and liberal norms. So the norms pertaining to the female gender lay on a continuum, from more conservative to more liberal. So some of the conservative norms that they talked about, they felt they were confined. They felt that their value was associated to their marital and childbearing roles rather than their educations and their careers. And such norms really endorsed women to be dependent on others. Liberal norms, on the other hand, women felt freer to make choices about their lives. Women that were strong and independent were accepted, and it really encouraged women to develop themselves through their education and their careers. I'm now going to move on to the first identity that I found in my work. So the first identity is called the submitter identity, and as the name suggests, this identity was a passive and dependent identity. Now, as we can see from the quote by Tahani, there was considerable functional restriction. So we're not saying that there aren't physical challenges with low back pain. So she says, I needed to use a wheelchair. One of her daughters needed to push her to the toilet. So you can start seeing the sense of dependence in this identity. She couldn't enter her room, which was on the top floor. She couldn't climb the stairs. So excruciating pain, really limiting pain associated with this identity. If we move on to the next quote by Ilham, she says, I would tell my husband I feel like my back is being electrocuted. So again, really excruciating pain that she was feeling. He wouldn't give me any financial support to get the medical attention I needed. So you start seeing another layer here, how being financially dependent detrimented her well-being and her health. She says, she says there wasn't any appreciation for the woman who took care of his needs and his house's needs. So you can see a lot of emotional distress here. She felt unappreciated, she felt uncared for. And she goes on to say, these things don't just happen in a day. It happened over years of feeling tired and neglecting myself. So you can see that there's a passive approach. She wasn't really taking care of herself. Her pain was really excruciating. But you can see the emotional distress and social conditions she was living under and how those were associated with her experience. Now I want you to focus on the diagnoses of those women, because throughout those identities you'll see that almost all of the diagnoses are the same, and yet their experiences really varied with pain. Now this was Ilham during her divorce. So I interviewed Ilham when she was getting a divorce, and towards the end I'll show you a quote of her interview 1 year after. Now the next identity, the camouflager identity. Now, as the name suggests, this was a masking identity, and it developed in relation to cultural norms which endorsed women's marital and childbearing roles. So basically, they prioritized their family's well-being over their own. And you can see in this quote, she says, I didn't go to the doctor for 8 years, I just lived with it, because I have to do my housework. So you can see how, So you can see how she was prioritizing her housework and her responsibilities towards her house. In the next quote, you can see she says, I always tell my family I'm fine. I don't tell them I'm in pain. Even when I'm in pain, I make sure lunch is ready. But there was an important factor that led women to behave in this way. She goes on to say, because he appreciates me. He treats me with respect and love. So you can see how having social support encouraged women to happily undertake this identity. And then in the last quote, she says, he became weak, her husband, who had colon cancer, so I had to act strong. He didn't help himself, so I had to support him. I was terrified, but I would never show my tears in front of him or his family. Now, this challenges medical understandings, because there are recommendations generally that we tell patients to refrain from any physical activity that aggravates their pain, to prevent any physical abnormalities to increase in their spine. But actually, women were happy that they could work around their pain and prevent it from interfering with their social interactions. And so this starts giving you an idea that although pain is physical, the physicality of it is not necessarily always the most integral aspect of the pain experience. The final identity was the combator identity, and as the name suggests, this was an assertive identity. As you can see from the first quote, Ruqayya says, the low back pain was not severe to an extent where it interfered in my life. It was annoying, but I did not let it stop my life. So you can see here that this identity is associated with pain that is more under control, whereas the submitter identity, the pain was more dominant. It was more excruciating. Women that showed this identity had more control over their pain. Moving on to the next quote, if you remember Ilham, we saw a quote by Ilham a year while she was going through her divorce. This was 1 year after. And she says, when I moved out of my husband's house, my family and friends supported me and helped me. So again, you can see some social support and emotional support in this period of her life. She says, things are better now, I'm secure and comfortable. So while she felt unappreciated and uncared for, there's a sense of security and comfort now. So more emotionally content. I feel comfortable from everything else, even illness. Illness does not come to me anymore. The back pain that I used to feel is gone. So you can see how people move from feeling electrocuted to feeling no pain at all, just because of changes in their social circumstances. And she says, we are free from the constraints we are living under. So you can start to appreciate how changes in people's social conditions really impact their emotional state and impact their experience of pain. Now, the assertive nature of this identity again shows in Asrar's quote. So she says, he, as in the physician, told me, I will give you the strongest painkiller and it should do the trick. I said, no, I'm telling you this won't work. Can I please ask you to refer me to get an ultrasound? Because sometimes there are problems in a patient's body that the doctor can miss. They found a tumor which was compressing the spine. And again, this challenges a lot of medical understandings, which places the health professional as an expert. When a person lives with chronic pain, it becomes a part of their daily existence, a part of their identity. And so they really understand their pain and they have expertise in their pain. And as I showed you a minute ago, we can't really place people's pain in generic labels or diagnoses that fit everybody in one box. So while physical pain is part of the pain experience, it is a very limited understanding of pain, or it only starts showing us the superficial symptoms of what people are going through. In order to understand pain, we need to start looking at people's emotions or their feelings and thoughts, their behaviors towards pain, and the social conditions and cultural norms which either facilitate people to take control and manage their pain effectively or impede their management of pain. So some concluding statements. The pain experience is embedded in people's identities, and in order to understand the pain experience, we need to consider emotional, social, behavioral, and cultural dimensions of their experience, as well as the physicality of pain. So understanding pain more holistically, so the multifaceted nature of this experience, would really help people manage it more effectively. And it would also help healthcare professionals in providing more holistic and effective care. Thank you.